Great. Good evening, everyone. Welcome to our first SWAG of 2025. We have some guest speakers tonight in the room with us as well as online. So welcome. Thank you, everyone, for coming. I think it would be great if we could just start with a round of introductions so everybody knows who's here. I'll go first. My name is Andrea Amico. I am co-chair of the Safe Water Advisory Group, Portsmouth resident, and around class of 2014. Passive.
Yes, I'm Vince Lombardi. I'm a city councilor representative.
With DES, I'm an engineer that oversees the large public water systems in the Seacoast region.
Alia Hayes, and I am the Oral Health Program Manager for the Division of Public Health Services.
Bill McQuillan, Fire Chief.
Rich Stevenson, Portsmouth.
Kim McNamara, Director of the Portsmouth Health Department.
Water Resource Manager.
Mason Caceres, Assistant Water Resource Manager for the City of Portsmouth.
Great. And if we want to just go to online, I see Laurel Shader is now on too. So I guess we'll start. I'll call on people. Gail, if you'd like to take a moment to introduce yourself, please.
Sure. I'm Gail Brown. I'm with the New Hampshire Oral Health Coalition. Happy to join you.
Thank you for being here. Karen?
Hi, I'm Karen Craver. I'm the Environmental Health Program Administrator with the New Hampshire Department of Environmental Services. Thanks for having me tonight.
Brandon?
Hello, I'm Brandon Kernan. I'm the Administrator of the Drinking Water and Groundwater Bureau at the Department of Environmental Services.
Laurel?
Hi, everyone. I'm Laurel Shader. I'm a Senior Scientist at Silent Spring Institute in Newton, Mass.
All right. And then I know it seems like we have some community members online as well, but we don't usually do introductions with them. So the next thing that we'll go ahead and do is we have to approve our minutes from our December meeting. So we need a motion to, the draft minutes were circulated to everybody. I didn't get any comments or feedback for edits. So we just need a motion to approve those minutes from the December 2024 SWAG.
Move adoption of the previous minutes.
Second.
Is everyone in favor of approving those minutes?
Yeah.
Aye.
Aye.
Is there anyone opposed to approving those minutes? Okay, looks like we're going to go ahead and approve those minutes. All right, so Al, if you want to bring up the slides or if they're already up.
Do that, yeah. Let's go.
Okay. So we have a pretty packed agenda.
Slideshow.
Yeah.
See if that works.
All right, so here's our agenda. It looks a little scary. We are going to cover a lot of ground, but we'll move through some of it quickly. But we're first going to start with, we have a fluoride presentation and discussion, and we have some guest speakers both here with us today in the room as well as online. And so we'll go ahead and get started on that first topic.
Sure, and I'll introduce
Sure.
the basics of this. Next slide. Mason will be our slide flipper here. So I thought this would be a good topic to bring up with this group, because fluoridation sometimes can be, I don't want to say controversial, but people have questions about fluoridation. I know Mason gets a lot of water quality complaints, and people say, well, I don't drink the water, and along with that, I don't like fluoride in my water. And so we get those type of comments. So it's important to get this information out there about what fluoridation is. That on top of the fact that this House Bill 691 was the latest one that went to the House. Did get killed in February, but it's just every year or two, there's always going to prohibit water supply. And we're seeing that even at the federal level now, potentially. So I thought it was a good topic that we can get some facts on here. So I'll start off just some basics of what we do in Portsmouth. So in 1975, the residents voted to add fluoride to the water. And since then, we've been doing that. We use two different chemicals for fluoridation. For the Portsmouth system, we use fluorosilicic acid, which is a very corrosive acid, pH around 1. When it volatilizes, it etches glass and metal, so we have to have the fluoride in separate rooms. And whenever our operators go and work with this chemical, they have to make sure there's a good air exchange before they go in. Very dangerous chemical to work with. And that's in its liquid form. Easier to handle is the sodium fluoride, and that's what we use at our P straight port system. When we use the sodium fluoride, we need to put it into a saturator, basically, water, so that it gets to equilibrium, and that water is used to pump in. A little less exposure pathway to operators that way. So Those are the two chemicals that we use. We follow the CDC recommendation of the target concentration of 0.7 milligrams per liter. And that plus or minus 0.1, so between 0.6 and 0.8 is considered the target range where we go with fluoride in the water. And with that, the first presentation I have here is the left is switch back out to the Zoom view. Gail Brown is the director of the New Hampshire Oral Health Coalition. Let's see if she is on there. Let's.
Should I be able to share now?
Oh, can you? She should be able to share. See if that works.
Let's try it. Let's see what happens.
I don't know if the
Nope,
other
nope.
online people were able to see the slides that are being shared in the room, but I wasn't seeing them.
We don't see them.
Yeah, she's sharing hers.
I can see hers, but I didn't, if there were slides in the room, I didn't see them.
I don't know how that works.
Yeah, we'll figure
So you
that
can
out once
share
we
and just do the
come
share.
back.
Right.
Yep.
Okay.
Okay, are you ready?
Yep.
Can I maximize this?
Okay. As I said earlier, my name is Gail Brown. I'm with the New Hampshire Oral Health Coalition, and I just want to make it clear, we are a local 501c3 here in New Hampshire. We've been doing what we do for 21 years. It's our 21st year. We are made up of folks who are involved in the advancement of oral health, be they public health officials, be they dentists, physicians, hygienists, disability advocates, and anyone and everyone that wants to advance oral health within New Hampshire. So our focus mainly is on education and advocacy. And what I'm going to do today is give you a little bit of background, both in terms of why community water fluoridation, a little bit of the status here in New Hampshire, and then close out from there. And so I just want to make sure that people know the first question I'm asked is, are you a dentist? No, I'm not a dentist. I'm not a hygienist. I am not a scientist. I am an advocate for advancement of oral health. So my training is 40 years in healthcare, public healthcare, and the law, regulation, legislation, and also in social work, working with people, advancing benefits. So that gives you a background, and I'll go from there. So I am going to literally give you a little bit of a background, because every time I've gone to something on community water fluoridation, we start talking about community water fluoridation. Well, I would like to talk about why community water fluoridation. And even though I tell you, oh, such a nice name, that we're with the Oral Health Coalition, what I'm really going to start with is about 4 slides about dental disease, because dental disease is what we are talking about, and 2 main types of dental disease, and this is why. Dental decay, which people often know as cavities, caries, soft teeth, rotten teeth. You may be familiar with some or all of those words, but if you're talking about this in the community, I'd just like you to know, most people don't know what caries means. Talk about dental decay, talk about cavities. The second main diagnosis in dental is gum infection, and we're talking about periodontitis, gingivitis, swollen gums, bleeding gums, inflammation. I want people to know it's not just teeth, it's about your teeth, your bones, your gums, your tissue, and the connection to all of that through your blood, your lymphs, and basically it's all connected. And when we talk about community water fluoridation, we are talking about prevention of disease. Sorry, I'm a little short of breath tonight. I have some medication I need to take, and it's time for it. So just bear with me. So what is the main cause of dental decay? We all have heard all of our life about the main cause of dental decay. Why do we have cavities? What shouldn't we do? I'm going to give you some choices here. Coffee and tea, sugar, milk and juices, bread, cereal, crackers, failure to brush or floss, bacteria, and viruses. I know you've all been thinking about that, and I'm going to ask you 2 things. One is, what do you think? And the other is, what have you been told all of your life? Okay, and I'm going to answer the question for you. The answer is F, bacteria. When I ask this question in trainings, I would say 80 to 85% of people say the wrong answer, which is the second one from the top. And I don't want to plant that in your head, so I'm not going to repeat that word. So the cause of dental decay, decayed teeth, rotten teeth, is bacteria. We don't know that. We're not taught that. I am going to just run down the list quickly so that you know why these other things come up, because they do contribute to different story. So the way that dental decay occurs is that you get bacteria inside of your mouth. When that bacteria gets sugar brought to it, then the bacteria will eat that and it will literally excrete, is the nicest word, excrete acid onto your teeth, and your teeth will start to decay. So when we talk to people about, well, you shouldn't eat so much sugar, so much candy, et cetera, really what they needed to do was not be exposed to bacteria in the first place. So I'm just going to run down the list quick. I promise you there's only a couple more slides on disease, but I think you need to understand what we're trying to prevent. Sugar, candies, and sodas. Moms say to me all the time, oh, I don't give my kids candy and soda. Hold on. Milks and juices both have sugar in them. I know you all went through biology in junior high, and you remember that about sugars. Juices, especially, my kids were encouraged to drink 100% juice. My kids were born in the 70s. It is now limited in the American Academy of Pediatrics. Bread, cereal, crackers. This is really important. This is where moms say, I don't give candy and soda. And I say, do your kids eat Cheerios? Do they carry a baggie of Cheerios, a baggie of Goldfish? We're talking here about fermentable carbohydrates, otherwise known as sugar. So failure to brush or floss. It's important to brush and floss. Helps get all of that acid off of your teeth that comes from the bacteria. Bacteria, it is transmissible like all other bacteria. And how do we transmit it? By saliva sharing. This is when my audience starts to get uncomfortable when I'm out in the community. What does that mean, saliva sharing? It means kissing. It means blowing raspberries on the baby. It means sharing spoons and saying, oh, look, mommy loves the peas. Let me put it from my mouth to yours. It's sharing Coca-Cola in the bottle, okay? And then viruses, I just put that on because I needed one more on the bottom. So I want people to understand this, because very often we blame people for what they eat. We blame people for what they feed their kids or don't feed their kids, and we blame them for not brushing and flossing. Those items are secondary to bacteria being involved. Okay, last slide on this topic. Okay, so what does it mean, dental disease? It means people now have infections. They have decayed teeth. They have bone loss. They might be putting their hand in front of their mouth when they talk to you because they don't want you to see. Gum disease, inflammation, bleeding, open sores. Bacterial and fungus get in there. Pain and pain management. Another day, I'd love to talk to you about how dental pain is a gateway for opioid misuse. Impact on full body health and systems. Okay, that's what has happened to the person. What does it mean? Why does it matter? It matters because they have broken, decayed teeth that they can't chew, they can't bite, they can't digest. They have difficulty speaking and communicating. They have difficulty concentrating and focusing due to pain or pain medication. The risk of addiction and recovery all factors into all of that. So we're talking about prevention, and one of the best methods of prevention that we have found over the past 70 years, and we do have over 70 years of research and data. Yes, it's varying quality of research projects. Yes, there are varying sources. Yes, some comes from China and some comes from Canada. There's a lot of information out there. There are meta studies out there that will compare that information and help you interpret it. I'm a scientist. I listen to what the American Dental Association says, the American Medical Association, the American Academy of Pediatrics, and on and on and on and on, after 70 years of research. Community water fluoridation has been shown to be the lowest cost. It is efficient, it is effective, and it is a way to prevent dental decay and all that sequelae I described. For every dollar that's spent on community water fluoridation in your cities, at least $20 is saved. I've heard higher numbers before. We're finding that with more fluoride options in the community, that not only has the level of how much fluoride is added to be optimal, but also that there's going to be less after cost, if you will, for people having dental care. So it balances, it's a balance. Studies show, and there are several, we don't have one in New Hampshire. Al asked me if I had one for New Hampshire, and I sure wish I did. Studies show that when community water fluoridation is stopped, that community decay rates do indeed increase. We know that. And we know that community water fluoridation provides both topical and systemic benefits across the lifespan, meaning it's important that that water soaks over the teeth, and also that the water that we drink the water and we have systemic benefits. Okay. So I'm going to go on to a little bit about New Hampshire, and then I'm going to wrap up. So in New Hampshire, we have the latest figure I found, 1.41 million population. And I did not realize this. If you can see the map, our population center is in Pembroke. You see here, Concord, Pembroke's right about here. And that is amazing to me. So I've always said that, you know, the center of New Hampshire starts at the bottom third. But you know what? It starts even lower than that. And so we have this huge southwestern corner. We have the Upper Valley, and we have all this northern part of our state that is very rural and very much affected by what's going on. Here you are over here in Portsmouth, Durham. It's not showing me my little arrow. There we go. Over here, and you're going to see something with where all of our, that is where almost all of our community water fluoridation is in this bottom corner. I think it's important to know that naturally high fluoride levels, now we're going to start to talk about, you're going to hear me talking about naturally high fluoride levels that exist, not when we're adding fluoride, they just exist. They're in bedrock, they're in bodies of water here in New Hampshire. And that we see quite high, or more of the higher levels in our Mount Washington Valley. If you want to go across your Saco River Valley, your Mount Washington Valley, your Franconia, Wolfboro, in these areas. But I will also tell you that one of my colleagues who has a nice little house in a little 6-house cul-de-sac right here on the Mass border has sky-high natural fluoride, and her 5 neighbors in the same cul-de-sac do not. So, you know, you need to know what's in the water. So naturally occurring levels in the bedrock and the bodies of water, I talked about that. We have 12 communities in New Hampshire, and I know I'm talking a lot to the choir right now because I know who's sitting around the table, but there are 12 communities that fluoridate their water through the public water system, and they serve approximately 260,000 people. Those little DWGs, if you want to write those down while I'm talking, those are the Department of Environmental Services information sheets where you can find that information. And so those 12 communities, we focus on them a lot. We focus on them, as Al said, every 1 or 2 years when we go back to the legislature, the topic comes up again. And we look at those 12 communities, okay? And several of them win optimization awards. Portsmouth is one. And has won it multiple years. And these are awards from the Centers for Disease Control in terms of optimization of fluoride and in their water systems, meaning they're getting the closest to the optimal level, which is going to be 0.7 milligrams per liter or 0.07 parts per million, okay? I'm going to talk about that. I want to talk, though, about the dates of initiation. New Hampshire has been in the community water fluoridation game for a very, very long time. The very first city in the country that was fluoridated was in Grand Rapids in Michigan, and that was, I believe, 1946. It was in the mid to late 40s. Concord came online in 1952. They fluoridated until 1960. They stopped. I don't know the politics of that, but I'm going to learn it from Marco Pilipon. I'll go see if he can educate me on that. And then they restarted in 1978. They've continued to present, and they are also award winners, much like Portsmouth is. Durham came online in 1955. Lebanon, 1956, and Hanover right behind them in 1958. I want to point out something, which is that those first four that came online are unique in that they are our capital city and our two largest universities. That tells me something about populations that are curious, that are information seeking, and that they were the first ones to come on board. I think that's important to know. Lancaster came on board in 65, Portsmouth 75, Dover 89, Laconia 89. I'm not sure in Rochester, Rich DiPentima there might know that answer. Manchester 2000. And I do want to mention Nashua because Nashua is our next largest city and it is not fluoridated. But I do want to start to introduce the topic that just because a community doesn't put fluoride in the water does not mean they're not drinking water that has fluoridation. And I want to talk a little bit about the halo effect, meaning that for Nashua, which is right on the border, and a lot of towns in Massachusetts being fluoridated, people are buying products that are made across the border in fluoridated communities. Bottled water is often, we have water bottling in our, southern tier. So people in Nashua are getting some fluoride in a variety of ways. They might go across the border and go to dinner and they're drinking fluoridated water. So the fact that a town hasn't put fluoride in the water does not mean that the population is not receiving fluoride. So a little bit about our saturation here. In New Hampshire, about 54% of our households get their household water from public water systems and 46% on wells. And there are people in the room with you that can speak to wells and well testing and all of that far beyond my ability to do that. But we are a state where we have a very high level of wells and that the fluoride levels in those can vary quite a bit. Okay, so once again, it doesn't mean they're not having fluoridated water. It just means they don't know how much fluoride's in their water. So New Hampshire consistently ranks low in water fluoridation nationally. We are often in, I wrote lower 40s out of 50 states. We're actually in the mid to higher end, meaning we're closer to the bottom. Okay, we are very close to the bottom on community water fluoridation. So I want to talk just for a few minutes before I wrap up in terms of this next point is very important. And I have to point out that Ms. Mates, who's from DES, is the one that helped me to start to learn about this. New Hampshire, I've been talking about 12 communities with public water supplies. New Hampshire actually has over 2,500 public and community water supplies. And as I've kind of been getting to the point of saying, that doesn't mean those 2,500 have 0.0 fluoride in their water. It doesn't mean that at all. In fact, all of those have some level of fluoride. It might be a 0.1, it might be a 4.0. Remember I said in terms that a 0.7 is considered optimal to balance health effects versus any negative effects, 0.7. Okay, so right now in these 2,500, I've seen the list, I've read the list. That's why I know how high they go and how low they go. So if you're in a town right now or a water system where that fluoride level is running about 2.0, which is where you have to actually be notified as someone on the public water system, you are having a fluoride water level that is about 3 times that optimal level of 0.7. So it doesn't mean, remember, I just said it, it doesn't mean you have no fluoride. It means you may not know how much fluoride you have in your water. And above that, when it gets to a 4.0, which would be about 5 times optimal level, and again, congratulations to the towns that are hitting that optimal level. When it gets to 4.0, about 5 times, then mitigation has to start. Okay, that's the law federally, and New Hampshire uses the federal law. So given that, I have not found where it says how low they have to mitigate it to. So if it's a 4.0, theoretically, they could get it down to a 3.9. You're still about 5 times optimal, but it's down below 4.0, okay? So I want to do that redirection. It's not I'm a magician. I just want to redirect you to, let's stop focusing on the 12 systems that optimize, and let's start saying, wait a minute, what is it we really want out of fluoride? What is it we do want on our water, and how are we going to deal with all 2,500 systems? Okay. So 2 more slides. This is the land of public policy. We live in the land of live free or die. New Hampshire maintains an ongoing dialogue about CWF, and the topics range from key points for challenges every 1 or 2 years at the State House. It's a poison, it's toxic, it's causing damage because it's toxic, it's pharmaceutical, it's a mass medication. Last year, I believe it was harmful to the human and fetus. The bill proposed wanted us to do a study of that in New Hampshire. We are not geared up to do the study for that. That occurs. There are universities all over the country, all over the world working on this. So that wasn't, let's say we didn't vote to do our own study. And then the state versus local right. That is a very important part of New Hampshire local rule. This has gone in 1 year, it might go to Health and Human Services. 1 year it might go to Resource, Recreation, and Development. This year it came a second time in my experience to Resource, Recreation, and Development. I've followed it and advocated through municipal and county government. Okay, so these are the different challenges that have come forward in New Hampshire. I'm going to slow my speech for just a minute here for any of you that want to write these numbers down. The laws and statutes that apply, general fluoridation, there's your RSA number, and then it looks at fluoridation for city water systems, town water systems, district water systems. Sounds like a whole bunch of rules, not so much. Because it's the same whether you're city, village, town, district, city. You need the signatures of 10% of registered voters to get the question onto the ballot. It's a very simple question about putting fluoride in the water, yes or no. And then when voting occurs, it needs to be approved by a majority of those voting. Okay, I just want to repeat both of those because those are 2 separate groups of people. It needs the signatures of 10% of registered voters. That's one group of people. And then it needs to be approved by a majority of those voting. Okay, and then there's a Venn diagram there. Okay, so you have that group in the middle. So, and if the vote is no, it cannot be brought forward again for another 3 years. Same process to vote in. Same process to vote out. So even though there's 4 statutes, the same process. I'm going to pause here. So again, if you want to jot someone's name down, you can. I'm Gail. Alia is in the room with you. Alia, you might want to wave your hand at them. And I missed who was here from environmental. I know, is it Jennifer Mates is here, and anyone else that I've listed here, Jason, Cindy, or Tom? No, okay. Okay. That's it for me, Al, and I appreciate you giving me that much time.
Great. No, thank you very much, Gail. Appreciate that. And stick around. We are very fortunate to have so many people from the state here.
One comment.
Sure.
Yes.
The process changed a bit as a result of Manchester. Because Manchester serves more than one community. We serve a number of other communities that Goffstown and Hooksett and Bedford and some others. So, but when we had the vote in 1999, we asked the Attorney General, do we need to get the signatures 10% of those other towns as well? The AG said, no, just Manchester because you own the water supply. So we did what the AG said. We went out, got our 10%, had the vote, we won. And then the anti-fluoride people sued us in court. And the court, what fluoride went in the water in 2000, December of 2000. They went to court and they said no because these other towns didn't vote. So the judge ruled in their favor, saying yes, the other towns should have had to be on the list. He didn't take the fluoride out of the water, but he required that we have another referendum. We didn't have to get the signatures of the other towns, but we had to have another referendum, including all the other towns that we served in Manchester. We had to vote in all those towns. And again, it passed in all those towns and then even a larger majority in Manchester than it did the first time. That was in 2003. But so any new town that wants to fluoridate, if they serve more than one community, like if Portsmouth were to try to fluoridate now instead of when they did in 75, they'd have to get the signatures of Greenland and blah, 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 and all those folks.
Too, right?
Yeah. So it's a little different process now, but that applies for getting it out as well. So it's hard to get it in, but it's just as hard to get it out if they follow the law. That's why they keep trying to change the law, not to change the law, but to just pass a law saying it's forbidden
Right.
and negate all the elections that took place previously.
Good point.
Question, do carbon filters filter out the fluoride?
And since we have,
If that's a question for me, I have no idea.
Reverse osmosis.
so we do have,
Activated aluminum.
oh, really? Okay.
Aluminum will do that too.
All right.
Leah, we could share her slides. She has some slides here.
Okay, I want to make sure that this is shared
Should be able
with
to
the,
go here and then share.
oh, I want to pull
I would
this
go
up
full
first.
screen first.
Okay.
Yeah, and then do the share. Which is
So-
hard, but it should.
Right. People in the audience, Laurel, can you see the slides now?
No, I'm not seeing any slides.
Okay.
Oh. I have to share first. Sorry. Right here.
That guy. You see that?
How about now?
All set.
Okay, great.
Yep. Thanks.
Great. Great. So I'm gonna reinforce a couple of the points that Gail
So
made.
could you pull the microphone a little
Oh,
closer?
yes.
Sorry, it's a recording.
Very
Pick it up.
loud. So I don't wanna, if I'm starting to yell, let me know. So I'm Alia Hayes again. I'm with the New Hampshire Oral Health Program, and I am the Oral Health Program Manager. We do several types of activities, but I'm gonna speak specific to the fluoride pieces that are up on the screen, and happy to take questions needed. So it's the two types of mechanisms of action are really important to understand in terms of topical exposure as well as systemic effects and how that changes how the teeth are supported. So topical exposure is when we have a topical application. Typically, a dental professional is applying something like a fluoride varnish, or you're brushing your own teeth and spitting out that toothpaste afterwards. Topical exposure helps really to reduce that rate of demineralization. So there's like a exchange process. We want to reach homeostasis essentially in our mouths. And that can promote remineralization of the enamel as we get those topical exposures. And so when you don't maintain homeostasis, you're demineralizing the teeth, which then creates a more an environment where you're more likely to have decay in those teeth. So systemic fluoride is going to support the teeth differently in terms of they're helping while they are forming during your development. So we think this is like especially important for younger children. And so it helps to ensure that there's more shallow fissures in those teeth, that the enamel's a little bit more solid and more resistant to decay, so that we can protect them in that long term. So we can, and you can go to the next slide. We really want to optimize all of the benefits of fluoride by three types of ways. We want those health applications. We want to have access to dental care. It can't be replaced by anything that we can do personally. We try to do that with a multitude of ways in the oral health program, but those are, your sealants, your fluoride varnishes, et cetera. Self applications, we want to be brushing with our own toothbrush, not sharing a toothbrush. There are definitely people in New Hampshire who cannot afford their own toothbrush per family member. And so it's really important to remember that even that piece, right, we're transferring bacteria potentially mouth to mouth. And then we also want to access fluoridated water systems when we can. So that really promotes this base level of raising all boats, which we love to talk about in public health because everybody has that base level of support. It's a very fiscally responsible way to work on supporting dental health. And I don't know about anybody in the room, but the last time I had a child who needed a filling, it was more than $32 for that one filling. So it's also really important to remember that as soon as we have something like dental decay and we have to do a filling, there is that literally the rest of your life, you have to watch that same area. It's not a permanent fix, no matter how good our coatings get, et cetera, or the materials get that we use to fill those teeth. They are always going to be, you always need to watch them going forward in those same areas. So we just want to improve outcomes for everybody. So since fluoride has been around, since community water fluoridation has been around, there's been people who oppose it for a multitude of reasons. We are continuously monitoring the research to ensure that fluoride added to community water systems is safe. And in fact, a reduction in the fluoride range. So it used to be this range. It's actually been narrowed down to the recommendation now at 0.7 milligrams per liter. That was in 2011 when that research started to come out. We finalized those recommendations in 2015. So it actually, that range was previously 0.7 to 1.2 milligrams per liter or parts per million. They're the same in this particular case, but now it's a much more narrow range. And then this past August, there was this NTP monograph that many people have probably seen splash across newspapers, but it was following a request from a group called the Fluoride Action Network to review the evidence around fluoridation. And there was evidence to show that there are risks involved in terms of fluoridation at certain levels, but the NTP, in terms of the National Toxicology Program, they are only allowed to cover risks. So there's no way to, in that type of document, weigh the risks against the public benefits. So risks were shown only in studies where levels were 2 to 3 times the current. And a study where an IQ reduction was initially shown on pregnant women, the indicator used was urinary fluoride. And urinary fluoride can't actually be linked to direct exposure level. And we know from monitoring of pregnant women that there is a difference in the absorption of different chemicals that are in the environment. So there's a higher difference in rates, I will say. So the IQ reduction also was very modest, and later on an Australian study actually found the reverse, that there could be an IQ increase in areas with community water fluoridation. So there is this continuous look to ensure that these levels are safe, that we are not posing undue risk to our communities, that we are making sure that if there is a suggestion in evidence somewhere that we're reviewing with the ensuring that the quality of those studies matches what happens in the United States, et cetera. So, but you will notice that it is even the phrasing of how we regulate fluoridation, it's regulated as a contaminant, right? So it's the maximum contaminant level. And even that phrasing can really kind of set people off. I'm a parent, I have 2 young children, and when I think about contaminants, I get concerned. So it's important to understand that while some of the headlines can certainly be splashy, and get our attention very quickly, it's really important to dig under and understand what exactly is different, if anything, and then deal with those concerns in regular, normal phrasing. I tried to read the judge's, I started reading the 300-something page judge's ruling, and it is a lot of technical language, but right at the beginning, it does say, this is not to say that community water fluoridation should be stopped. We need to just be cognizant of the evidence, so. And I think that's all on that particular slide. The other piece that we are trying to do in New Hampshire, it is much harder than one would think, because of that, that what Gail called the halo effect, but what I will call like kind of the blending. We have, for instance, as it's Rich, right? So you raised the idea that Manchester has fluoridation. We also blend that with communities around it. So it's very hard to find a community that is not affected by community water fluoridation at some level. But what Massachusetts study found that they are seeing about 50% higher mass health claims in areas that do not have community water fluoridation, and Mass Health is their Medicaid provider. So it is important that we kind of support the dental care of children, and that is not always, it's not always possible to get access, thorough access to dental supportive care. So community water fluoridation definitely is an important component. And then lastly, this is our CDC graphic to really show why community water fluoridation in one picture. Happy to take any other questions, and also happy to get back to you with anything else you may need after this night. So. Yeah.
I remember a number of years ago, my wife worked for an organization called Kids Count. And part of that was an understanding that dental care in the North Country was tremendously lacking. And so they were not getting the fluoridation there. And I assume that there's a lot more well water there than there is community water. So
Yeah.
What's happened with that?
Yes, so the North Country has definitely had times where there's more support. The Molar Express was up there for a little bit, but it is one of those pieces where when funding drops, amount of funding drops, it tends to be something that goes quickly in terms of dental care being supported or not supported. We do have it's called the Northern New Hampshire Mobile Health Clinic van. It started off as a project for kind of immunizations, health education, et cetera. I've been on the board of that for a couple of years now. So we're trying to see if we can potentially help support some of the dental care there. We also support federally qualified health centers to support some of the personnel costs, because Medicaid rates don't always cover everything that you need. But there is definitely a lack of providers, and they will tell you, I just went up to Coos County Family Health Services a few weeks ago, and they sometimes are having people travel and for 2 hours to get to an oral surgeon. And again, as you know, Gail was talking about the piece about getting care for a dental decay before they have to go to an emergency room, end up with an opioid prescription, end up with, you know, antibiotic, kind of, we're feeding our own cycles. So it's an area that we're looking at, trying to figure out how to support that best. We also have, there's a provider that brings up this like large operatory. It's essentially like a long, camper kind of thing, but it's got multiple operatories, Solvere, and they will bring, while we don't have sufficient Medicaid providers at this time, dental providers accepting Medicaid, we can bring that van in to kind of at least help support base level of dental care. But it's a process. It's not, and there's no simple fix, I would say.
Can I add to that a little bit?
Please.
When I was in the legislature, I had a bill passed that we set up a program to allow primary health care providers, pediatricians, primary care providers to provide oral health screening and fluoride varnish to Medicaid children. Before that, it could only be done by dental professionals. Most Medicaid kids don't have a dentist. Medicaid is so low that most dentists will not take Medicaid patients, even children, particularly children, because there was no Medicaid for adults at that time. So now, at least with that program, and I didn't get a lot of support, I have to say, from the oral health program at the state, actually, at the time. But anyway, that would now allow at least Medicaid kids, when they go see their primary health care provider, which they do normally have, that they can get fluoride varnish and at least a screening of their teeth. So that's at least on a prevention level. That doesn't deal with all the other kids that are not on Medicaid, and their parents may not have dental insurance. And of course, you know, we don't know what their fluoride level is in their water and their wells. It could be low, it could be high. And the interesting part about it, if they don't test the water, the pediatrician may put them on fluoride supplements, thinking that they're not exposed to fluoride. So they may get supplemental fluoride in tablets and getting it in their drinking water, and they may be getting more fluoride than they actually need, and may be causing fluorosis and those sorts of things. So that's why it's important to know what's in your water, both if it's a public water supply that's not fluoridated or a private well that you don't know what's in it. So.
This is Gail again. There's also some school-based programs that are happening, and that varies throughout the year. There are about 200 schools through a variety of programs that have some school-based services where they will get fluoride varnish, where they can get sealants, where they can get some cavity arresting treatments, which really can make a difference. But just as Aaliyah was saying before, there's just not enough providers serving enough children. So any prevention piece, especially something as broad-based as community water fluoridation, helps. Thank you.
Oh, yeah. Is there any resource? I'm just stunned that not every kid has their own toothbrush. And so it seems to me that that's not an impossible achievement.
Yeah.
So are there resources for people to get free toothbrushes?
So this is one of those things that as soon as I started talking to, there's a group called the Traveling Tooth Fairies. They're working in Nashua. And they had a launch earlier this year of they're doing a school sealant program, and we are supporting them with funding. But I was talking to one of the legislators in the room at that point, and I said, isn't it awful that I go to the dentist on a regular basis because I'm fortunate enough to have dental insurance, and we go 3 times a year because our dental insurance actually covers that, and they go to hand me a toothbrush in a bag with toothpaste, and I say, no, it's okay, I have them, I don't need it. But if we could actually take those and distribute them to the kids who actually do need them, so that's what I would love to start to push for, even if we can't get more dental professionals to take those Medicaid kids. What if they're at least donating the toothbrushes and toothpaste, and they go to community clinics health fairs and things like that, and they'll give them out. But we don't.
I think that's our
necessarily-
next public health campaign, Rich.
Yeah.
Yeah,
Right?
no.
I mean, it's, or like, if, the penny thing, the petty concept, if you have a penny, give a penny. If you need a penny, take a penny.
Hmm.
Like, how awesome would it be if like, you have a toothbrush, give a toothbrush. If you don't, if you don't need it,
Yeah.
put it into this dental box, and the dental professionals can get together and redistribute to those school systems that.
Are the traveling
Pantries. like a
Yes,
food pantry.
yes, food pantries, right? We've got so many different food initiatives. And if we could give them healthy options for food packaged with a toothbrush.
Right.
Do the traveling tooth fairies go outside of Nashua?
They do, they are taking on as much as they can in terms of their program, but there's different. We support at this point 6 school-based sealant programs. And so, and they're distributed throughout New Hampshire, so I can get you the one that's closest, to here where we could hopefully help support more kids.
And if I may?
Yeah.
So you might not know the answers to this. I remember the
Probably not.
Manchester Healthcare oral van, dental van.
Yes.
And I love the idea of the mobile vans. That's really the only way to get anywhere. But do you have any idea how those are funded and what it costs to operate one for a year?
So in terms of cost, we only support part of the personnel costs and supplies costs for those mobile clinics. So I only know what we fund. We have a breakdown on their invoicing, so we can try to do the cost benefit and help them with their return on investment piece. So I can't off the top of my head tell you, unfortunately, but it's not as much as you might think. And it's a pretty cost effective way, especially when you couple that with community water fluoridation, but at least, just preventing those carries on those kids, because Medicaid is state funded partially. We want to think about preventing having to have so many kids having dental emergencies, that we're spending money for, and we want to be able to support those kids before they get, have.
Oh,
That my dentist told me that, the toothbrushes they give away
Yeah.
are given to them by the toothbrush companies. They're, so,
Yes.
so it's not,
Yeah, it's not all them.
maybe we should just take the middleman out.
Right? And I have to say, Northeast Delta Dental, so DentaQuest is our Medicaid provider for adults. And DentaQuest has, and Northeast Delta Dental has been extraordinarily supportive of many different programs across the state of New Hampshire. So I'm of the mindset that nothing is impossible. I would love to see like a toothbrush drive, like we do canned food drives. I mean, my kids, we're sending in everything to the schools, everything, including like card games, for kids who have, not enough toys at home to stimulate kind of their brains, like in their, as they're lock and key kids usually that are going home to empty houses. So, there's a lot of opportunity, I think, and I would love to see just simple as like, I've got my toothbrush, I don't need this, like, and I routinely clean out a whole, medicine cabinet full of toothbrushes that everybody brought home. So really, it'd be. I would-
Aaliyah, if I could add to the part about the school programs for just a minute. So in regards to the question around the cost of a school program, some programs are still being done in vans. And if you have a dentist that's coming out, you need a van with dentist equipment. But a hygienist can come out in an automobile and can do the services that they're licensed and authorized to provide out of an SUV. They can set up everything they need on a card table. So it really depends on how big and broad the program is that you want to build. So there are 14 programs, if you will, serving the 200 schools I talked about. And they're funded in all different ways. So as Aaliyah said, the state provides through her department funding to 6 of those programs, but that means there's 14 programs. So the funding comes from a wide variety of sources, and there are donations from Kiwanis, and there's road races that fund school programs, and the city of Milford just pays for the program. City of Manchester pays for part of the program. So there's all different ways that comes in. There are private grants that occur. So you know, it can be put together in many, many ways. And I would reflect on what Aliyah said was, if you've got a vision for it, you can make it happen. We can make it happen. So, you know, just it's not the old box truck van is not the only model anymore. And thank you for asking that question.
Thank you.
Great, thanks. Yeah, we, good conversations, but we need to, we have a short amount of time left, and I did invite Jen to speak a little bit about New Hampshire DES, so.
Yeah,
that
and
role, but-
DES's role is actually pretty small compared to everybody else involved in this. As has been mentioned before, 0.7 milligrams per liter is the optimal amount of fluoride to have in the drinking water. So we get monthly operating reports for all of our large systems, and for the 12 that add fluoridation, we're looking at that to make sure that they're meeting that optimal level. And if we see any discrepancies, we'll call and ask what's going on, you know, oh, my pump failed, so that, you know, it took 2 days to get repaired. But for the most part, all 12 systems are really good about keeping that at the optimal level and maintaining that. So DES is reviewing those reports monthly. It has daily readings of the fluoride levels. And then we do report that information to the CDC. And then we have other information that gets reported to EPA, but since adding fluoride isn't a regulatory requirement, EPA doesn't care about that until you get to the other thing that's been mentioned of the naturally occurring fluoride, which there are regions in the North Country around Conway area and Bartlett area that do have high levels of naturally occurring fluoride. There are a handful of treatment systems out there for removing fluoride from water systems to get them below that 4 milligrams per liter. And any system that has over 2 is required to do public notice annually to their consumers to let them know, so that they can talk to their dentist about it and say, no, my kid doesn't need fluoride treatment because we drink the water at home. But then you get into the private wells where there is no regulation for water quality of private wells in New Hampshire. Most people only get a water test done because their mortgage company required it when they were purchasing the house. And even then, it may not include fluoride. It may have just bacteria and nitrates. You know, it could be some very, very basic chemistry. So there's probably a lot of private wells that do have fluoride in them that people just aren't aware of. The treatment for that is a point of use, either reverse osmosis or activated alumina cartridge filter. Those can just go under the kitchen sink, and then you connect your refrigerator dispenser to it. And, you know, it's order of magnitude cost about $500 for those. And the test is relatively inexpensive too. It's just that getting people to remember to do that is part of the problem. And the regions where there is high fluoride don't have a lot of certified laboratories to easily take a test to. So they would have to drive an hour to drop off a sample. So, but New Hampshire DES involvement really is just making sure that the dozen water systems that are adding it are meeting the optimal levels, and then us reporting that. And we also do inspections of the treatment facility every 3 years for all community and municipal water systems. So that's part of the review during that inspection. Yes.
I don't know if this is for Al or for you, but if there's two different types of fluoride that can be added to water, why wouldn't people choose sodium fluoride if it's so much more easy to handle and less?
For us, it's harder to handle the quantity that we would need for, so in Madbury, we have
Oh.
the fluorosilicic, because it's liquid form, more concentrated, we could add it.
And it's the
Yeah,
same.
Manchester and Concord are the only other two facilities that do it, and they are dealing with large flow rates and to manage the dry versus doing the silly acid, that it just makes it so much easier to operate the system. And these are very high-level systems with high-level grade operators who know their stuff. So it's not just a little mom and pop kind of small community system. These are really well-trained folks, so there's less of a concern there.
I have a question. Does bottled water typically have fluoride in it, or does it depend on the brand?
I'm not really familiar with that. I don't think that it's added to that, but maybe if Brandon is on here, if he knows anything about bottled water.
Yeah, most bottled water, you would expect to have fluoride. Anything that's purified water is treated with reverse osmosis, so it wouldn't have fluoride in it. Some of the natural spring water may have some levels of fluoride in it, but I wouldn't expect it to be at elevated levels.
Okay, thanks. And then question for Alan Mason, is fluoride on our annual water report? Do you have to report that? Okay, as a metric? Okay.
Yep.
All right. Any other questions?
Thank you.
Well, oh, go ahead.
And
Kim.
there's
Yeah.
there's no byproducts. Once it hits the water and everything, there's no byproducts that you worry about aside from fluoride.
No.
Thank you.
All right. Thank you. Thank you so much to our speakers. Thank you for coming.
Thank you.
Thank you.
Welcome to stick
Yeah.
around, but. I
Yeah.
understand.
Littles to bed. Thank
Yeah, sure. Thank you so much.
Well, next favorite subject is
Oh.
lead.
I think we have a,
Staying for that one.
Um,
we have a question from Rose.
Public comment at the end?
I think she has permission. Yep, you're all set.
Rose, if you want to ask your question.
Yes, can you hear me?
Yes.
Yeah, so Jen, I wanted to ask you, there's a bunch of studies that state that the fluorosilicic acid leaches lead from pipes. So I wanted to know if the state has ever looked into the communities, the 12 communities that fluorinate their water, if those are the communities where there's higher levels of lead. There was, 1,200 kids diagnosed with lead poisoning. And I'm also concerned about the corrosive fluorosilicic acid interacting with disinfection byproducts like chlorine that we use to disinfect the public systems.
I actually see Cindy Clevens on here. She is our treatment expert, so I'm going to defer that question to her. Cindy, if you can, yeah, there.
Yeah, can you hear me?
Yes.
Yes.
Yep.
Yeah, good evening. We do test lead in all our non-transient systems. That's all our community systems, including the fluoridated ones. And we do not see any increase in lead levels from fluoridated systems compared to others. And in addition to that, all our water systems must control corrosion and pH as part of their water treatment process. So that is the main mechanism how lead is controlled, is by controlling pH and alkalinity, and that is happening for all those systems. So no, we don't see any relation of lead in drinking water with fluoridation.
Thank you.
Thank you. All right.
I think as far as the chlorine issue, I don't think there's an issue with chlorine. The chlorine by itself has a problem in terms of its the chlorohalomethanes that come out of chlorine, not related to fluoridation. But any water system that uses chlorine has an issue with that byproduct of chlorination, which is totally separate from the fluoridation issue.
All right, thank you very much. Okay, I think we're ready to move on to our third topic, New Hampshire DES regulatory update. And I know we have Brandon Kernan here from DES.
Sure, so the biggest thing with updating you on what's happening regulatory wise is we are in the process of implementing the federal lead and copper rule, the rule that came out last October. In addition to managing the seacoast water systems, Jen Mates, who's there with you in the room, is spearheading our efforts in that area. The federal lead and copper rule is one of the most complicated, longest, and costly rules ever developed by EPA, and it requires a lot of work by the water systems. All the service lines have to be identified by 2037, but really 2027 if you don't want to have some sort of regulatory penalty, so to speak, with addressing lines with replacement plans. So we're working hard on that, and we're also working really hard on implementing the federal PFAS MCL that came out last April and final rule from EPA. There's a big caveat though now on both those rules, since there's been a new administration and it hasn't received really any media attention. I did send you a note, Andrea, the other day, just letting you know I was going to mention this, that EPA petitioned the court that's hearing an appeal of both the lead and copper rule and the PFAS MCL. And the appeal in court was made by a lot of people, of course, industry, but then two entities that represent water systems, America Water Works Association, the major trade association for water systems, and the America Metropolitan Water Agency is another major organization representing water systems. They sued EPA on the PFAS rule and lead and copper rule. And what EPA wrote to the court on February 7th is request that the court not take any action on that litigation for PFAS for 60 days while the new administration reassesses the rule. And so by early April, we're going to get information to see if EPA is thinking about changing the rule or pulling back the rule, or maybe they won't do anything. And they also submitted, I should say, the court responded immediately to that request and granted the 60 days. So we're definitely in a waiting period. As I said, the same request was made for lead and copper, and I have not seen a response from the courts on that request, and I've been looking. But again, these are both very poorly covered topics, but they're huge. So we are under tight timelines. Water systems are under incredibly tight timelines to come into compliance with these new rules. We're using all of our energy, all of our efforts to really educate water systems. They're investing a lot of resources and time into being on track to meet these rules. But we might find ourselves in what Jen Mates calls a bad game of red light, green light, where, we're really pushing, and all of a sudden there could be regulatory uncertainty. And that's also a big concern because we have temporary funding from EPA for 2 more years to address emerging contaminants like PFAS, and to also a lot of money to address lead and copper. And all of a sudden, it's a lot harder to decide where to target those dollars if you don't know where the regulatory driver is going to be. Yeah, we can't hold on to the money. It'll get reallocated or just taken away from us. So uncertainty is not a great thing, but that's looks like what we might have soon. But again, we won't know until probably early April for PFAS, and I'm not sure about lead and copper. So those are the big updates. There's a few other things on PFAS. We are submitting claims. New Hampshire Department of Justice opted into a class action settlement for water systems against 3M DuPont, BASF, and Tyco. And we've submitted 663 claims for 3M and DuPont, and we're about to do the same for Tyco and BASF. The way it's going to work per legislation and then a decision by the Drinking Water and Groundwater Advisory Commission is the settlements will come into Department of Justice. It'll go into the state's trust fund, which will then reimburse water systems that have invested in PFAS mitigation up to the amount that they receive compensation for under the settlement agreements. And there'll actually be a dollar amount for each source if the water system showed that they expended money to address PFAS. Or we'll offer a grant up to that amount if they need to invest in mitigation for PFAS to comply with the federal MCL. If the federal MCL goes away, the only driver at that point will be the state MCL, which for PFOA it's 12 and PFOS is 15, so quite a bit higher than the 4. We have 300 sources of water that are over EPA's MCL of 4 parts per trillion. About 100 of those were over the state MCL, and they've mostly been addressed. So we have about 200 sources that will have to take action to comply with EPA's MCL, and we estimate that could be about $0.3 billion in cost. We're talking Manchester Water Works, Pennachuck, Nashville's water system. You very quickly can get to a few 100,000 people in the state that are drinking water above EPA's 4 part per trillion MCL. Again, with the state MCL, most of those have been addressed already. So we're going to be pushing that money out, and we're going to couple it with temporary federal money for emerging contaminants. So healthy systems meet the MCL, if that still stands for the federal level of 4 parts per trillion. And we're gonna try getting systems to invest in treatment using these dollars very quickly. But again, if the standard changes, it'll be much harder to motivate people to take action. So a little uncertainty, but that's kind of the big highlights. There's a lot of other things going on, and I'd be happy to answer questions.
Sure. Thank you, Brandon. I have a couple questions. Has DES been affected by any federal funding that's been on hold, or, we've heard of other programs losing funding or funding being paused, and I'm just curious if there's been any funding to DES from the federal side that has been on hold and affecting any of your work?
I can definitely speak from the drinking water and wastewater side of things. And no, right now we're still able to access all the grants that have been awarded to us. The way it works is we get awarded grants, and usually they go back a couple of years, and you can draw dollars out of those grants to an extent ahead of time before you spend them, but you can't draw all the dollars. And those processes were frozen for a couple of days, but they're functioning just as they used to at this point. I'm not quite sure about other areas so much, like with air, climate change, and things like that. I would defer that to the commissioner's office, or perhaps Karen has something to say about it.
I can weigh in a little bit about our program's funding. So we did have some climate planning funding that was frozen temporarily, but it has been reinstated, and we are able to access those funds. And then we have a sizable grant from the Agency for Toxic Substances and Disease Registry, which is the part of CDC that deals with environmental health. And that funds 3 people in the environmental health program: a principal investigator, a risk assessor, and a health educator. And we've still been able to access those funds and to continue operations as normal. So we're grateful for that.
Yeah, the thing we're really waiting to see is the future of our funding looking forward. We have 2 more years of temporary funding from the infrastructure bill for emerging contaminants, lead and copper, and then traditional infrastructure investments. And then we have our traditional base SRF, which has suffered cuts in the last few years to pay for earmarks. And as you may be aware, all the federal agencies are looking at cost cutting with information due by March 14th. So we'll be looking to see if that impacts any drinking water funding looking forward.
Okay. Thank you. I have 2 other questions. The settlements that you talked about against like 3M and DuPont, has that been finalized? Will New Hampshire definitely receive money? Or are you saying if the settlements happen, that the process, it'll go through the DOJ, or is it definitely happening?
It's definitely happening. We opted in. You had a period of time where you could opt in or opt out, and the Department of Justice decided to opt in, and it's a settlement, so you're nowhere close to being made whole. But the judge overseeing the settlement had consolidated all the water system cases nationally, kind of with waving his finger, was really warning people, you go it alone, you're looking at 8 to 10 years. He's really going to try forcing settlements even after this class action settlement. Discovery will be complicated. There will be fights over what jurisdiction, and he made a real case that this is your opportunity. And also, these corporations all have limits, even though they're huge. The liability on this topic is huge. And so financial liability, I think, was also a consideration for the long term. But it's a sure thing. Where we're at now for 3M and DuPont is for the 663 sources we submitted claims for. We have scores based on the level of PFAS, the amount of water historically used, and the capacity of the source. And they need to finish. The settlement administrator, which is a neutral party paid for through the courts, has to now look at all the scores nationally, and then we'll get a prorated amount of, I think, $7 billion for 3M and DuPont, and it's maybe 1.6 or 5 billion for BASF and Tyco. But again, that's for the whole nation. So it really depends on how many people put in claims. The difference in New Hampshire is New Hampshire is the only state that did the work for their water systems. That's a legal precedent that was established back in the early 2000s in litigation with MTBE, where we said we as a state represent all water systems. So we actually put in the claims, so we got 100% submittals, and it was very complex, the data requirements. I understand from claims administrator, I've heard secondhand that a lot of people started filling out claims and never pressed the submit button before the deadline. I never completed the data requirements, and so I think New Hampshire will be well represented in claiming its damages, which is important because you get compensation just not for exceedances of the federal MCL or the state MCL. It's any detectable level PFAS you get compensation for. And we went out and sampled all of our sources using 2 analytical methods using the lowest detection limit. So we found PFAS where we could.
Yeah. That's great. Last question, is the PFAS rebate program still up and running, and do you anticipate any lack of funding where that would stop?
It's still up and running, and I believe they are well funded at this point. They had a pause for a bit because some legislation passed required that they have rules in place, and they didn't quite have rules yet, but that got changed. So it is up and running. It's recognizing the 4 part per trillion federal MCL for private well owners. I'm not sure that'll be the case if that rule gets pulled back. They really need to be grounded in a regulatory driver. And so again, if that rule gets pulled back, not only will the water systems quite not know what to do, but it will reduce the number of private well owners that can access the rebate.
Okay, great. Thanks. Any other questions?
Laurel had her hand
Oh,
up.
Laurel has her hand up. Laurel?
Hey, everyone. Thanks for the update, Brandon. I had a couple of questions. If EPA did decide to undo the MCLs, it took them so long to develop them. Can they very quickly undo them, or is there any sort of bureaucracy that could slow that down?
I'm not sure. I mean, until this occurred, my understanding was these rules were pretty locked in. The Safe Drinking Water Act has some very strong anti-backsliding provisions in it, meaning you can't undo an MCL or water it down. But I guess the logic here is that it's a new rule, and that's been challenged out of the gates by American Water Works, American Metropolitan Water Agency. And so the anti-backsliding, this might be a way to get around that now, because how the rule is made is what's being challenged, not the actual value itself, if they didn't follow the process. So I'm not sure. It seems like anything's possible these days. So I'm guessing it could be pulled back pretty quickly if the administration wanted to do that. And there'll probably be more court cases on that activity.
Mm-hmm. All right, thanks. And if they did get overturned, I think you said that New Hampshire would go back to the standards that are currently in place, or I guess are in place, right? Because the
MCLs that we have in place right now. When EPA proposed their MCLs, we had a number of technical questions on it that I don't feel like the people that worked on the MCL at the time felt like were completely addressed. So we would go back to what we haven't. It's in statute at this point, but it's confirmed with an annual reevaluation by Karen's group of the MCL each year, if they should change or not. And so if we were to change it, it would come out in that annual review as a recommendation, and then we'd have to go through the rulemaking process.
Mm-hmm. Got it. So would New Hampshire consider like kind of codifying the current EPA standards, or not clear what would happen?
I don't think we'd jump to that right away. It would be part of that annual evaluation, and EPA had a draft MCLs out there during these evaluations, and I don't think we were quite there yet. Is where we are at. But again, we would keep looking at the latest science, which is required by law, and make that determination each year.
Mm-hmm. Okay. And one more question. I know another thing that has popped up is something that some people would like to overturn is the addition of PFOS and PFOA to the CERCLA Superfund law as hazardous substances. I was curious, have there been any new Superfund sites in New Hampshire that are in the process of being established based on PFAS now that those two have been added to CERCLA?
I don't think there's many new Superfund sites, period, anymore. I think the sites are legacy sites, and probably the legacy sites, like our plain old standard waste sites, probably have PFAS at those part per trillion levels. Some may have it at more elevated levels. So the only real development of CERCLA in New Hampshire is that PFAS, if it's covered under CERCLA, then now it has to be addressed in the record of decisions, and as they get reevaluated periodically. be part of the remedies at their sites. The other thing going on with CERCLA is there is national legislation that's really important to wastewater and water utilities that restricts liabilities for wastewater and water utilities associated with PFAS and Superfund. And that's important to them because one, wastewater and water systems overlap Superfund areas, unfortunately, and all water systems and wastewater collection systems leak a little bit. And the way Superfund works, you're a responsible party if you put a truckload of contamination in it in the site, or a teaspoon. Everyone gets pulled in, and so people don't want their leaky utilities to make them part of a responsible party. Also, residuals are generated by both water and wastewater entities, and they don't feel like that. They didn't do an activity that produced PFAS like traditional industrial polluters have, and they don't feel like that should pull them in. And so that legislation is introduced in the House at this point and seems to have bipartisan support. It's just a matter of can get through the process.
And last super quick question, the multi-district litigation, was that the big case in the South Carolina court that's been going on for a lot of years, or is it a different one?
I believe that might be the AFFF one more. This one, I believe, was a different court. I can get you the exact court that it came out of.
Cheers. Thanks.
It's you can quickly Google PFAS settlement and see all the legal documents there, and so right away you'll find the court that made the decisions.
Thank you very much. Are there any other questions? Okay. Thank you, Brandon. Appreciate it.
Yeah, thank you.
All right, we'll move on to our next agenda item, number 4, PFAS update. And I know we have some slides to share on that. Okay, so this, we have a couple components of the PFAS update. I know Al has some data to present. A couple things I wanted to cover was I wanted to ask, I know the last time we met, the Air Force or the DoD had issued a policy about how they were going to address the EPA MCLs and start with 3 times above the MCLs first. And, I think one thing that's really important for us on the city side to pay attention to is we have 2 city wells that have been impacted by PFAS from Ps, and we want to make sure the Air Force is going to implement treatment on those 2 wells. That's the Portsmouth and Collins well. And so I wanted to check in with Al to see if there was any update on the Air Force working with the city to get treatment on those 2 wells and where things are at with that.
Well, one bit of good news about our sidestepping that a little bit, the Pease treatment plant, we just got a draft agreement from the Air Force today that we're reviewing for the 5-year contract to keep the operations of the Pease plant going.
Okay.
That's a good side note, but there is some movement with the Air Force. As far as the design of the Portsmouth and Collins well sites, no news yet. Latest I heard was funding wouldn't be available until FY26, which starts October of 25 for that. Our timeline for construction, based on what we got from our engineer, would be starting design this summer and basically a 2-year construction period for that. So that would land us in 2028, which is right before the 2029 deadline.
Yeah.
So we are on a tight deadline to keep that moving. So we need to keep pushing with that.
Okay.
Unfortunately, we do need to get those funds from the Air Force to be able to enter into that final design. The estimated cost for that design is $586,000 approximately. Which is
Okay.
a substantial amount just to get us through design.
Right.
So we will need to keep pushing the Air Force for that initial funds.
Okay.
So no great news on that front, but
Okay. All right. Good to know.
and on the other hand was the Greenland well. And we're still moving forward with that, hoping to get that bid out in FY26 and get that construction. That should be a shorter construction period. So hopefully by 2027, we do have funds available to start moving ahead with the Greenland well.
Okay.
I'll get into my charts in a little bit and discuss
Sure.
that further, but
Okay, great. Thank you. And then the other thing that I wanted to just raise awareness to, and I'll just briefly mention it and then pass it over to Laurel Shader, who's our scientific expert on the SWAG, to just tell us more about this study. But in January, a study was published about the association of PFAS in drinking water and cancer rates, and it broke it down between cancers in females and males. And I just thought it was, again, where I think the EPA MCLs had lawsuits filed against them, and there's a lot of questions around the levels and, are they too low? And I just think studies like this are really important to understand the health effects that PFAS have at very low levels. And I just wanted to raise this study with the SWAG to be aware of. So with that, I will pass it over to Laurel if you'd like to just give the SWAG an overview of this study that just published in January.
Are her slides on here, or does she have them?
Sure. I didn't make any slides. I thought I would just talk for a couple of minutes. Thanks, Andrea, for inviting me to talk about this. I'll admit I've read the paper kind of through once. Would love to read it again and dig in a little bit more deeply. And I'll also say I'm not an epidemiologist by training. I've kind of focused more on the exposure side of things. So parts of the study I kind of dug into more than others. But yeah, one of the challenges with doing studies that look at a health effect like cancer is that you really need to have a lot of people in your study to have confidence that you're seeing a link between people who have higher exposures to PFAS or some other contaminant and a certain type of cancer outcome. And I know it feels like cancer is really common and a lot of people have cancer, but when you break it down into each type of cancer separately, it can be challenging to have statistical power to look for differences. So for instance, I'm part of the ATSDR multi-site study, which is big and takes a lot of, it's taking a lot of time, and the PEAS results are part of that. That has 5,000 adults and 700 kids, and that's considered too small to do a cancer study. So I thought it was kind of intriguing, the approach that this study took. So basically this paper by researchers at University of Southern California looked at cancer incidence data for some counties across the country, representing about half of the US population. So that gives you a lot more statistical power. It's a different kind of study. So epidemiologists call it an ecological study, which you might think involves like critters or something, but it's a study on people. It's more of an observational kind of community level study. So a lot of epidemiology studies involves recruiting people and collecting blood samples and looking at a more individual level. And these are kind of more of an observational study. So if there's some sort of difference in how communities have been exposed, you can look at differences at kind of community level exposure rates and then community level disease outcomes. So there's some strengths to that because you don't have to actually recruit a ton of people, but obviously some limitations because you're not able to really assess each individual person's exposures. So what this study did was to look at county level incidence of the many different types of cancer, and Andrea had that on the slide up on the screen. And what they did was link that to data from UCMR3 and UCMR5. I know some of you are quite familiar with that, but just a quick reminder, UCMR is EPA's unregulated contaminant monitoring rule in 2013 to 2015. That was UCMR3, which was really the first kind of nationwide look at PFAS in drinking water, and I think really shone a huge spotlight on PFAS and prompted a lot of future action. The limitation of UCMR3 was high detection limits. So most samples came out as non-detect, but that was because the tests weren't that sensitive. And then another way so they're using UCMR3 data, and then the more recent UCMR5 data, and we're in the middle of UCMR5, and that is including more water systems than were in UCMR3, more PFAS, and more sensitive methods. So it does provide quite a bit more information, although the detection frequencies are still kind of low. It is in some ways underestimating the prevalence because the detection limits are like 2 to 20 nanograms per liter, and we know a lot of labs can get down to 0.1. So basically what the study did was to look at cancer incidence by county, and then they sort of assigned for each county whether there was PFAS detected in any public water supplies in that county. They used a new EPA data set that either compiled or estimated the boundaries of public water systems across the country and kind of used GIS to overlay that with counties. They took into account other factors as well. So for they were able to account for age and sex, I think they had that for the individual cancer incidence cases. They also looked at air pollution, smoking at a community level, smoking rates, obesity, and different SES measures like poverty. And so as Andrew mentioned, the kind of key findings were that they did find some associations between some PFAS and some of the cancers, and often those associations were found in males and not females, or vice versa. I'm not as familiar with sort of the physiology side to know which, and toxicology side to know which linkages like make more sense or not. I did flag one thing that was kind of interesting was PFBA. So that's the 4-carbon short chain cousin of PFOA. Previously had been linked with COVID mortality in a study by our friend and colleague Philippe Grandjean from Denmark. And the explanation for that, or some like biological plausibility, came from another study that found that PFBA seems to accumulate in the lungs. So there was some consistency there. It was kind of interesting that PFBA seemed to be the one linked with respiratory disease. For some other ones, you know, I don't know if we know yet why certain, like one specific PFAS would be linked with one type of cancer or not. So I think it was an interesting and important study. I did note some, to me, what seemed like important limitations that the paper didn't really address. And again, I'm more on the exposure side, so I think it's challenging, and I think they did the best they could. But for each county, a county was considered having PFAS if any water system in that county had a PFAS detect, and they treated the UCMR3 and UCMR5 data a little bit differently. They also looked at whether the water would be considered above the EPA standards. But I'm not as familiar with sort of the number of water systems in each county for New Hampshire systems, but just to give you an example, on Cape Cod in Massachusetts, where we do a lot of our work, there are 15 towns and 18 water systems in Barnstable County, which is basically Cape Cod. Hyannis is one of those water districts, and it had quite high levels of PFAS and UCMR3. Cape Cod has 200,000 people, and Hyannis has 14,000. So the county of Barnstable County would be considered as having a PFAS detect in UCMR3, even though most people weren't really exposed to the PFAS in that drinking water. So it's like a little bit of a challenge in terms of making those linkages. After UCMR3, Hyannis put in millions of dollars worth of activated carbon treatment. So now in UCMR5, you know, they wouldn't have those PFAS showing up, but the people living there would have had that past exposure. So it's, you know, I think it's an important study. I think it's important to note the limitations. I guess the other thing I wondered about, if you have a big county and you have a lot of water systems in your county, you kind of increase your chance of having at least one detect. Whereas if you have a small county with few water systems, it's kind of like flipping a coin. Like, are you ever going to get like, you know, at least one heads or something? So it wouldn't quite be 50-50, but the more water systems you have, the more likely you might have one that shows up. And they didn't sort of look at the proportion of water systems with detects. It was just, you know, did you have at least one? But despite all those limitations, they did see some statistically significant associations. So I think it's worth looking into more. I kind of want to ask some of my epidemiology friends what they think of the approach and how robust they think the methods are. But yeah, I think it's noteworthy they saw these differences. So happy to answer any questions as well as I can, or to like report back.
Rich has his hand up, so.
I'll ask you a question as an epidemiologist. I haven't read the study, so I can't. Can you send us the link to the study, first of all?
I did email it, Rich.
Oh, I missed it. I'm sorry.
Yeah, that's okay.
My fault, my bad. The second question was, what were any confidence levels indicated in terms of statistical levels of confidence in their findings?
Yeah, in their graphs, they sort of showed the incidence rate, the incidence rate ratio. And so they had kind of an estimate of that. And then they did show the confidence intervals. So for most of them, even if the sort of middle number was above or below 1, the confidence intervals were kind of wide. So they did really only talk about when the whole kind of confidence interval was, above
Any,
1.
any statistical significance associated with it?
For some there were, and it's kind of a little bit of a lengthy list, but yes, there were some pairings of specific PFAS chemicals and specific types of cancer where they did see a statistically significant increase in the incidence rates. And they also did calculations to sort of equate that to how many additional cancer cases they would estimate that would equate to.
Is that at the 95% confidence level, or?
I think it was, yeah. Andrew sent the link for it, so that's pretty typical to use.
I need to shut up and read the study.
Yeah, I mean, they did use 0.05 for the p-values, and they also tried to take into account the fact that if you do a whole bunch of comparisons, the likelihood that you'll have one that's significant just by chance kind of increases. So I think they did account for that multiple comparisons.
We send it to you, Rich, too, and there's some of it up here on the slide too. But I'm happy to reshare it.
Okay.
Okay, any other questions? All right, thank you, Laurel, very much for breaking that down for us. Appreciate it.
Sure.
Great, and then I think, Al, you have some PFAS stuff that you're gonna provide an
I can
update
just
on.
Go through this really quickly. I just wanted to show some charts. I don't know if I presented this data in the past of all of our PFAS data from our, 3 sources I have here. And I'm doing this because of this concern about, well, what if the EPA pulls back their rule? Like right now, EPA's limit is 4 parts per trillion as we're moving ahead here. And I marked on here the DES's MCLs. So this is the Greenland well. Data goes all the way back to 2014. Some of that older data where it's 0 is just, it was below detection limit. And back then the detection limits were a lot higher. So we're not seeing that, but generally there's not much going on here. Pretty straight trend, which is a good thing in a way. It'd be nice if it dropped out. There was one point in time when I looked like things were dropping, but came right back up. But we're still down around that 4 part per trillion range. And for the Greenland well, it's just a PFOA that is averaging around 4.7, so it's just a little bit above the EPA's limit. Next slide is of the Portsmouth well, I believe. A lot more data here since the Air Force is taking monthly data of the Portsmouth and Collins well, so we have a lot more data. This still goes back to 2014. Portsmouth well, of all of our wells, has the highest concentrations. As you see, they average more around 6 to 8 to 10, just under 10 for PFHXS. Very solidly above that 4 part per trillion EPA limit, but all below the New Hampshire DES's limit. So if the EPA pulls back that rule, well, we're going to be sort of stuck in limbo because here we don't have the regulatory driver from the DES to put the treatment on, and we're kind of stuck in the middle. Similar with Collins wells, lower concentrations here. Generally, it's the PFOA here that is above the 4. And the next slide has some of the summary values. Yes, that's actually PFOS in Collins well 4.3, just over the 4 is our rolling 12-month average. Greenland well 4.7, and as you see, Portsmouth is the one that's a little bit higher. And I didn't plot out anything for our Madbury sources. They're all consistently below 4. Albeit there is some PFOA in all of our sources.
All right, thank you. Any questions about that from anybody?
I should add that all of this data is going to be included on the updated CCR, which is going to be rolled out before July 1st of this year. I think it's on the 2nd page of the CCR, right next to the main data table page where you can look at all of our PFAS data included.
Okay, great.
Yep.
Thank you very much. All right, without any questions, we're going to switch it over to item number 5, our lead discussion. And I wanted to pass the floor to Rich DiPentima, who wrote an op-ed and cited a report that had just come out. So Rich, we'll pass it to you.
Thank you. Yeah, actually, the op-ed was prompted by legislation that's currently being heard tomorrow. Actually, the House is going to vote on House Bill 691, I think it is, or that, I'm sorry, it's 724. I can't keep track of it. 724, I believe, is the lead bill tomorrow, which is a very good bill. It would it would allow for more primary prevention, lowers the level of lead exposure that's considered to be elevated. It would also now allow the state to go into, if when a child is poisoned, not only inspect the apartment the child lives in, but all the other apartments in that building. Of course, the property owners, the landlord association came out against the bill, and it came out of the committee inexpedient to legislate. But tomorrow is House, it'll be on, it's not on the consent calendar. There'll be a floor vote on this one tomorrow. I suspect it will not pass, unfortunately. I did email every state representative yesterday, my comments about the blurb that was written in support of the ITL and inexpedient to legislate, but I'm not confident it will pass. But anyway, despite that, we tried to convince them based on a new study that came out from the Department of Health and Human Services Division of Public Health Services. Some of it was not surprising, but some of it was pretty shocking, actually. For the last 5 years, the number of children who were identified as being lead poisoned were 4,570. And for the year 2023 alone, there were 1,142 children diagnosed with elevated blood lead levels at the 3.5 micrograms per deciliter. Assuming that we have about 30% of the children that are at age 1 and 2 that have not been tested, we could confidently say that that number is significantly higher than what's actually been reported. So that's a lot of kids with brain damage that are going to be going through our school systems and through our society for the rest of their lives. And it's going to have significant costs associated with that, both from special education costs, healthcare costs, criminal justice costs, and all the other associated costs related to lead poisoning. Unfortunately, those numbers are not easy to get and not easy to quantify. And it's very difficult to convince legislators that spending some money that you don't even have, the property owners have a responsibility to maintain their properties, is going to save society a great deal of money, but we can't come up with a number and say that this is what it's going to do. It was kind of interesting at the hearing on this bill when I testified that the property owners association, they're very much supportive of the property owners, saying that, well, the property owners are being punished because there's lead in their homes, and they're being punished because kids are being lead poisoned, and they didn't put the lead there or anything like that. So, but my argument was, well, most of the property owners bought these homes with the knowledge that there was lead in the homes, because as of 1992, when you buy a residential dwelling unit, you had to be notified of any hazards that existed in that building, whether it was lead, radon, or any other things you had to disclose relative to that residential building. So the property owners knew when they purchased that building, if they bought it after 1992, that there was lead. So they had the knowledge that they were buying something that had a potential for them to have a negative consequence down the road that they may have to have some liability for, both legally or economically. But that argument didn't seem to fly very well, even though the property owner is saying, well, it's very expensive to mitigate, abate a house from lead. And I said, yeah, it is expensive. But you knew that expense was potentially there when you bought the property, right? Well, no, not really. I really didn't,
But you don't have to take all the lead paint out. It has to be encapsulated.
Right.
if it's not
There
taken out,
are
right?
different ways of mitigating lead. You
Yeah.
can do a total gut rehab, or you can do a combination of windows removal of certain things, and encapsulation of certain areas. And that's interesting because I got a response from the fellow who wrote the blurb for the majority report for ITL, saying that, well, the state says that the lead abatements don't remove all the lead, and that it could become a problem later on down the road, using that as a good excuse not to pass the legislation. So rather than doing at least the the encapsulation and the mitigation now, they were saying, well, we don't want to do anything instead. So that's, it's kind of illogical, but that's, so I raised the point with him. I said, it's like if you bought a used car and that car had faulty tires and faulty brakes, but you still bought it, then you own the responsibility of fixing those brakes and those tires before you can get it registered or inspected and get past inspection, right? Well, that's different. That's different. Yeah. But anyway,
And just
it's
to be clear,
unfortunate,
with all
but
this is
here we are with lead.
This is lead paint talking about, right?
Yeah, 50 years or so later, kicking this lead can down the road, and we continue to kick it down the road. And I don't know how many more children will be poisoned over the next, how many years. And we know that, 70% of the lead comes from houses, from paint, 70%. So, it's not rocket science. We know how to fix it. We know how to prevent it. We know how to do it. It's just, it's a community and a political will decision on how do we do it. Now, if this is a problem for landlords being able to afford to do it, then maybe the community needs to step up and say, okay, why don't we take some part ownership in this, since we own these kids when they go to school in terms of their special education needs and all that. So maybe it would be beneficial for the community, for example, to say, we will give property owners a tax break on your property taxes, like we do with veterans or seniors, give you a tax break if you show your home was built before a certain time and had lead hazards identified, and that you mitigate that lead in that house, and you can show the city with the town that you mitigated that lead and it became lead safe. You had an inspection by a licensed lead abater. We'll give you a property tax abatement for that. Let's give the property owners an incentive instead of just excuses to not do something. There are multiple ways we can help property owners, helping ourselves to cut the cost that we are going to bear as a community. Unfortunately, I don't see the political will for it, and I don't see anybody talking about it. And that's the frustrating part of this, Having dealt with a kid that died of lead poisoning, having led the investigation of a 2-year-old kid who died of lead poisoning in Manchester, who had 0 lead in her body when she came to this country and then ended up with 392 micrograms per deciliter 3 months later. That sticks in your mind for the rest of your life. You don't dismiss that. And we're allowing this to continue, allowing thousands, 4,570 kids over 5 years to become lead poisoned in one little state.
Right.
So,
Thank you for your efforts.
I don't know where we
Rich.
go from here, and my
Yeah.
level of frustration has reached the point of no return. I know the bill will be killed tomorrow, and the legislature and the property owners will be slapping themselves on the back, thinking that they're not going to have to spend money to save these kids. So the property owners won't be punished, but the kids will be punished.
Well,
Thank you, Rich. Yeah, we'll pass it to Kim if you want to add anything.
sure. Well, Rich made the point that there's a community decision that can be made on this. And I just gave you these pieces or these papers that are in front of you, just excerpts from some information, but RSA 130A 5D is the top paper that you have there. And that is a law that became effective July 1st across the state of New Hampshire. And it simply says that in buildings that were erected before January 1st, 1978, when lead paint was banned, any conversion to rental units or daycare shall require a lead-safe certificate issued by a licensed New Hampshire risk assessor prior to occupancy. So that's a state law that's in effect right now, and it just started last July. However, in Portsmouth, what you have in the second pages are just excerpts from the Portsmouth ordinances. And so we already have a rental housing inspection in our Portsmouth ordinances under Chapter 14, which is the housing code. And it says that every building used in whole or in part as a dwelling for one or more persons shall conform to the requirements of these sections, irrespective of when such building may have been constructed, altered, or repaired. And the Department of Inspections or its representatives, and it includes the housing code inspector, building inspectors, of all variety, and they're empowered and directed to make such inspections. So we already have that on our book, but we don't actually have this process going on at this point in time. We've never actually done rental housing inspections for occupancy. So a certificate of occupancy in our ordinances is required. And a certificate is issued and it's good for a period of 3 days from the date of issue. So one thing our community could do is just institute the ordinance that we already have. We have a fantastic chief building inspector, Shanti Wolf, who's all on board with doing a rental housing unit inspections. And including lead with that. So it wouldn't be that he's just starting a lead program. If we just use the ordinance, it would have to be tweaked a little bit because the language is a little old. But he's quite willing to put lead into this rental inspection program that he's been hoping to start for a while now. It's just that their workload in the building department is so much. So it would require another building inspector to be able to do that. But we should be doing what other communities, I know in Manchester, we had this, that every 3 years, rental housing gets inspected and and the owner receives this certificate of occupancy that says you can rent this out. So you wouldn't have to inspect these apartments every time they turned over. It would be once every 3 years for the building. And I can't speak for Shanti budgetarily, but because they can charge for these inspections, the program could potentially pay for itself, is his thinking. And so I would really like our community to look at this issue. We already have the tools. We already have a willing and quite capable inspections department. And if we now could find a fee structure that pays for this, we really don't have to wait for anything to happen at the state. So that is my hope.
I mean, this is wonderful, but I think the devil's in the details. You have the inspection, you look for lead. What constitutes a lead hazard and what doesn't constitute a lead hazard to get a certificate of occupancy?
Well, so there's different trainings. The New Hampshire lead risk assessor or lead inspector. And I think that those things can be worked out and can be put in some sort of format so that everybody has that information. But really, when you go in and you're doing your rental inspection, housing inspection, you're looking at, are there electrical wires hanging out? Are there smoke detectors? Are there stairs that are wobbly? And so you're also just looking, are there surfaces that are flaking and the building is pre-1978. And so the paint should just be painted over to ensure that it's encapsulated. So I don't think it has to be a really difficult process. There are also tools that can be used if you want to, the XRF gun, XFR gun.
XRF, yeah.
Which just pointed at something that determines if there's lead there. But it isn't to make sure that every building gets all the lead taken out. It's just that it's made safe for anybody that rents there.
Yeah, well, that's like in Manchester, they had that under the building department. And one of the items in their inspection was loose and flaking paint. Okay, and they had that for long. Of course, they never enforced it. The child that died of lead poisoning in Manchester that house had a certificate of occupancy, and there were all tons of loose and flaking paint on the porch. The kid was eating paint that was 40% lead by weight. So, I mean, yeah, again, the devil's in details and who's doing this and what details do you have and what level of enforcement is going to be allowed and both legally, because you have to see if it complies with state law and all that other stuff too. So you have to, that's where it may get a little dicey in terms of compliance with state law, because the city will probably get sued by a property owner saying you don't have the authority to do this under state law. So that's where the state law thing might have to come in again.
Right. Well, we discuss lead at every meeting typically, so I'd love to continue these discussions and talk about how we can progress. Yeah. So thank you very much, Rich, for your op-ed and your education. Kim, thank you for bringing these resources too. And I think this is a topic we will continue to talk about.
Given the time, I think we can, if you're okay with it, skip over the water supply update. I can,
Sure.
in one line saying we're still watching the drought. It's still happening. We still have a drought. We're still in a moderate drought. It's not severe like it was in December, but we are watching it and we are watching groundwater levels. And you know, as things progress towards spring and depending on how the snow melts and their temperatures and such, we'll see what kind of recharge we get, but it's still the flag is still up that there may be water use restrictions come spring or early summer, depending on how things turn out. So I won't go through any of these slides. I would like to get them to the next order of business, though.
Okay, so yeah, number 7, letter of support for Greenland well treatment funding. So Al, he printed out a draft letter of support from the SWAG, and I don't know if you want to just kind of preference
Yeah, I can-
why we wrote this letter and what we're asking for.
Right, so every year, Senator Shaheen and Representative Pappas put out a request for any projects that they would like to fund through federal funds. It used to be earmarked funds, now they call it congressionally directed spending funds. And we often put requests in. This year, the Greenland Well PFAS treatment facility, we are submitting an application for that. So part of that is requiring letters of support from interested parties. So we have a letter from the town administrator in Greenland, and we're requesting the SWAG to review this letter and see if you're all in agreement that we submit this letter in support of requesting. We're requesting $1 million to support, since the Greenland well was originally going to be a $2.5 million project, and now we're looking closer to a $7 million project. Any funding that we can get for that will help. So we wanted to raise this up. So if we could review this, and if we could get a vote to see if we could have Andrea sign this and submit it with our application, that would be wonderful. The deadline is this Friday, so.
Yeah, I did send a draft of this on Monday, just if people had a chance to look at it ahead of time, and nothing's changed from this printed version. And so if folks are in agreement, I think we could do a motion to approve this letter being sent to Senator Shaheen on behalf of the SWAG, supporting these congressionally directed funds to help assist with the Greenland well. Okay, so we got one, I think, so Rich will make the first motion. It'll be the first, and then do we have a second?
Second.
Okay. Is everybody in favor of sending this letter of support for these congressional directed spending funds for Greenland well?
Yes.
Yes.
Okay.
These are going all, sent both Shaheen and,
This one's just for Senator Shaheen.
just Shaheen?
Yeah.
For the-
Yeah, they're
because of
different-
our committee.
Different parts of my, different requests.
Okay. Is anyone in opposition of this letter? No. Okay. All right.
Great, thank you.
Okay, so we'll pass to get that sent over, and
Yeah, we'll send you the email. It'll need to be uploaded directly, so when you sign it, you can just scan it and send it.
Okay. Sounds great. All right, thank you. All right, we'll move on. So we've been talking about revising our mission for a while. Several of our SWAG members are not present tonight, so I really want to just, probably turf this till our next meeting where we hopefully have more present. But we've talked a lot about what our current mission is, what we've updated the city council. If you want to go to the next slide, please. Last in December, in our last meeting, I had proposed a mission. So down below is the proposed revised mission. The yellow is what I had proposed in December. Green is based on feedback that I got from SWAG members between the December meeting and now. And so I just want to put that out there for everyone to see it. And then I think it's something we'll have a more robust discussion when we have more members of our SWAG present. But just looking to expand our mission, because when we first made this group, it was very heavily focused on PFAS. And we've certainly expanded our topics to cover many other things related to quantity, quality, preservation, and different infrastructure projects. And I think that's been really important to the work that we do. And I'd like to see us continue to do that and have our mission reflect that. So not much to really cover right now, other than it's continuing to evolve based on your feedback. Thank you so much. And we'll have a more robust discussion next time. I won't spend too much time on this. This is not pertinent to drinking water particularly, but this is a project that I collaborated with UNH on, Dr. Paula Mauser. I reached out to her last year asking for help with sampling foam. Foam is kind of an interesting thing that happens on waterways where it accumulates around the shore and sometimes on the surface of the water. And in other communities, they've done foam testing to find that in communities where there's known PFAS contamination, the foam can highly concentrate the PFAS, much more than you see below the surface water. And, you know, through my efforts, I've raised this concern a lot through the RAB with the Air Force, the Restoration Advisory Board. And there's another RAB member, Rosalie Leprestu, who is on the RAB, and she's also, I believe, on this call tonight. She's also shared concerns about foam accumulation in the community. She's seen it at Barry's Brook and Rye. I've seen it around Great Bay. And so we were really grateful that UNH collaborated with us, obtained a little bit of funding to do a pilot project where we were able to sample 4 paired foam and surface water samples. And the preliminary results have come back, and it does show that there are higher levels of PFAS in the foam than the surface water below. Foams had a much higher PFOS concentration than the surface water beneath. And we saw with the PFOS that it concentrated from 24 to 161 fold and total PFAS 7 to 71 fold. So, again, I'm not really going to get into the weeds on this, but because of these results, UNH has now applied for a grant to do more expansive foam testing in the region. And here's just a couple pictures of foam that I have observed. And then if you want to go to the next slide, I just wanted to point out for the community that New Hampshire DES issued a fact sheet on PFAS and foam. That's to the right, and I linked it up. It's a 3-page fact sheet. Essentially, the underlying message is if you see foam on waterways, you should avoid contact with it. You know, don't let your kids play in it. Pets, if you do come into contact with the foam, you should wash it off with soap and water. And there was some press coverage on this project. UNH has they have a press team, and they issued these results, and there was some coverage in the Boston Globe as well as WMUR. And so I've linked those two if anybody wants to read that or look at that. But I just, not drinking water related, but PFAS related on waterways. And there was a new fact sheet that just came out. So I just wanted to bring that to everybody's attention. Yeah.
Is there any thought that the foam is actually being caused by the presence of PFAS?
Yeah.
Because I think of PFAS at the fire suppression stuff is foaming.
Yeah.
So.
Yeah, I think there is naturally occurring foam that can
Yeah.
just happen in waterways. But then what we've seen around Pease, Barry's Brook, where other communities across the country have seen in communities that have high levels of PFAS contamination, they're seeing these white fluffy foams
Much more.
come together. And so, the concern is that, I'm not a scientist in the form that I can't speak to how the foams are occurring. You often see them after rainstorms. You see them on really windy days. So, scientifically, there's a reason why the foam accumulates in that way. But I think the key point, at least from my perspective with the community, is that if you are in an area where there's PFAS contamination, like Great Bay, and you see foam accumulating, just don't touch it, and you try to keep your kids and your pets away from it, because it could concentrate the contaminants, and you don't want to come into contact with those things. So, okay. And then, really the last thing before we get into public comment was just community education. So again, I know it was a suggestion for a mission to add about community education, and really just looking for SWAG members to give us input on ways that we can do more community outreach or provide topics of education, like fluoride was an example tonight. I know SWAG member Kotri, who couldn't be here tonight, she suggested looking at water systems and cybersecurity as a future topic. Some of the things that we've done so far to provide education to the community, we hosted a community drinking water forum in May of 2022 that was recorded. We've had SWAG members go to the farmers market and hand out information on the lead water testing program. And then we've also hosted a variety of speakers here and in our SWAG meetings where we've talked about, many different topics. Lots of PFAS topics, but even beyond lead, fluoride, et cetera. So just looking to see if there were any other suggestions from people, any other needs in the community that you think that we should be covering or trying to fill any gaps, educational gaps that the SWAG could be addressing. And I know it's getting late and we're a little bit over. So if you all want to also think about it and send us emails as well, you can, but really would love some guidance. from our community partners on the SWAG who could help share if there's any gaps out there or questions or concerns you're hearing from people that we can help address. All right. We just got to open it up to public comment. I know we did have a few people from the community. And if you want to make a public comment, if you could just raise your hand. And if we don't see any hands, I think we will go ahead and close out the meeting.
Also.
So,
Move
Oh, we
to
see.
adjourn.
okay. All right. Sounds great. All right, we're going to go ahead and adjourn the meeting. So I just want to say thank you all for coming.
Mhm.
Thank you for your participation. Thank you to our speakers.